Thanks to the establishment in the early 90s of the National Glycohemoglobin Standardization Program, also known as the NGSP, significant progress has been made in standardizing laboratory A1c testing. Today, the hemoglobin A1c test is widely used as a diagnostic and monitoring tool for diabetes, and standardization has helped to ensure consistent and reliable results. This has been an important step in improving the care of people with diabetes. This standardization means, in theory, regardless of the method the lab is using, a patient's A1c result will be the same no matter where their sample is sent. However, not all methods are created equal. This is demonstrated when the patient has interferences present, which may be common. These interferences include hemoglobin variants, such as hemoglobin S or sickle cell anemia, as well as hemoglobin C, E, and other less common variants. Despite standardization efforts, methods differ in their suitability for A1c testing in patients with these hemoglobin variants. To begin with, traditional immunoassay methods use antibodies to recognize a limited section of the A1c molecule to generate a percent hemoglobin A1c result. Similarly, a newer method for measuring hemoglobin A1c is the enzymatic assays, which use enzymes that recognize and digest a targeted section of the hemoglobin A1c molecule. However, both of these methods are unable to differentiate between normal and most variant hemoglobins. As noted by the ADA, the presence of variant hemoglobins may lead to an altered relationship between A1c and the patient's glycemic state. The inability of these methods to detect the hemoglobin variants fails to provide additional information about the patient's clinical status, which may ultimately impact treatment. Another methodology with a similar limitation is boronate affinity chromatography. This is a technology that separates all glycated hemoglobin from non-glycated hemoglobin to derive its A1c value. Similar to immunoassay and enzymatic techniques, this technology is incapable of recognizing when a hemoglobin variant is present. In contrast, another method used for A1c testing is high-performance liquid chromatography, or HPLC. HPLC separates different types of hemoglobin based on their affinity for a packed column under different pH and ionic balances, allowing for the measurement of hemoglobin A1c as a percentage of total hemoglobin A. This leads to a patient result which displays the distribution of all hemoglobins in the patient's sample. This is an improvement in the case of hemoglobin variants, as many variants can be detected as separate and different from normal hemoglobins. Sebia's capillary electrophoresis, or CE, shares this advantage. CE is a method used to measure hemoglobin A1c, which separates hemoglobins based on their size and electric charge. It, like HPLC, also presents a pattern result showing all patient hemoglobins. However, capillary electrophoresis provides this improved result with better resolution in a faster and more automated manner. The sophisticated software used with capillary electrophoresis technology enables clear, data-driven decision capabilities that may be ambiguous with the HPLC systems, which are only able to automatically flag major interferences. The confidence that CE provides assures labs they are generating the best possible results without sacrificing any conveniences of automation or throughput.